We hope you'll join us each second and fourth Thursday at 11:30 for a new topic and conversation. Our conversation today is on developing resilience. We're really glad again that you're here. And today we're also being joined by the York Lunch and Learn group. Thank you for joining us today. SC Thrive leads South Carolinians through to stability by providing innovative and efficient access to quality of life resources. I want to tell you about this tree, this willow tree, and I want to give you a statement by Robert Jordan. The oak fought the wind and was broken. The willow bent, and when it must, it bent and survived. And if you have an opportunity, I'd like you to keep a piece of paper handy and a pencil or a pen. And one of the things I'd like you to do at the end of this program is to look up the Oak and the Willow poem. Because this picture is really big about resilience and what we're going to talk about today. Many of you know that oak trees can be very tall and they can be firm, but they don't bend well. And you can see there's 12 different types of willows, but each willow will bend with the wind. It will bend and flow, ebb and flow. And that's what we're going to talk about today. Is there's times where we have to be able to bend and we have to be able to go with the flow. So we're going to talk about that today. Hurricane season is coming upon us, and the trees are really going to see the need to be able to bend. When faced with a tragedy, a natural disaster, a health concern, disappointment, defeat, failure, resilience is how well a person can adapt to what's happened in their life. A person with good resilience has the ability to bounce back quickly. And a person with good resilience is able to bounce back a little bit better than a person that doesn't have resilience at all. You know, resilience isn't about sailing through the life unscathed. There's going to be challenges that develop, and unfortunately, there's going to be stress. One thing that the Marines have, they have a shirt that people wear, and it says, "Pain is weakness leaving our bodies." And unfortunately, with everything, there's pain. But the more we work out, the more we go through pain, the stronger we get. It's all about experiencing negative, difficult, and distressing events that life throws at us, sort of like the pandemic that we're in right now. It's important for us to try and stay on task, to be optimistic, and to be high functioning. You know, if we never ran into disappointment, we'd never know how to deal with it in the first place. And we'd never know how to help others who are going through disappointment and other problems. We'd never know how to help them. CrossFit and other programs are really big these days. And if you were to walk into a CrossFit gym, or another gym, this is the sight that you may see. And you know, one of the bad things that we do as humans is we size people up. So if you initially looked at this woman and said, she's going to lift 300 pounds, she can't lift 300 pounds. Or you might her when she first walked into that gym and said, that's 300 pounds. I'll never be able to lift that. But she lifted over 300 pounds over her head. And she's doing it with people cheering her on. While certain factors might make some individuals more resilient than others, resilience isn't necessarily a personality trait. It's something that we gain, something that we learn, something that we possess. Resilience involves thoughts. It involves change of behavior. It involves being resilient for one reason that is showing us that resilience is ordinary. It's not extraordinary. It's like these folks working out. Building muscle, it increases your strength. Building resilience increases your opportunity to bounce back. But it takes time and it takes intentionality. But you know, there's good news. You can grow your resilience by choosing and practicing actions, behaviors, and attitudes that make you strong. When you look at this stump and you look at this tree, one of the things that you've got to remember is about hope and recovery. You know, when this tree was cut down, no one thought about the hope and recovery of future growth. But here this sapling grew out of this stump. If we have a fixed mindset that causes us to shy away from challenges because we don't want to feel embarrassed or humiliated in front of others, that's going to restrict our growth. It may immobilize us to take action or make a decision. Those times in our lives was when somebody said, "Well, say something," or "We'll make a decision." We feel that we can only do what we've done in the past. This can be a problem because the fear of making mistakes causes us to avoid challenges and new experiences that are going to give us joy in our life. It's so important for us to not have the attitude of what today, well, I just hope I can get through the day. It's not about getting through it. It's about how am I going to grow through today? What am I going to experience today that's going to help me grow? If we have that growth mindset, we can enjoy challenges, even difficult ones, because we value learning and growth. A growth mindset can turn any experience into a learning experience to strengthen our resilience. You know, when we try new things, we don't know what we're doing, and that's okay. But if we have that growth mindset, we can build new skills more easily because we believe we can, and we can really work at it. These are 4 areas that we're going to talk about. You know, focusing on these 4 areas helps us. One of those is connection and social support. In previous forums, we've talked about having that go-to person to encourage us. It's so important. We've talked about physical wellness. We've had some incredible weather, and just to be able to sit outside and rest and recover is huge. You know, the other thing is there are things that we do that have purpose, and it's the purpose that drives us through them. And the last thing is, one of the items that we've talked about in each forum we've had is having that mental wellness and having, for instance, when we talked about finances last time, watching our impulses and sort of running it by someone. Do you think this is a good idea? Because if you have somebody to run it by, they can run things by you as well. And it helps both of us get through life. So resilience kind of comes down to 4 categories: psychological, emotional, physical, and community. I want you, if you have an opportunity, another thing I'd like you to write down is Team Hoyt, H-O-Y-T. Mr. Hoyt he and his wife had a special needs child born. And the physician said, put your son in a facility. He said no. And the 2 of them have finished many Ironman competitions all over the United States and Hawaii. In Boston, there's a statue about Rick and his son. So I want to encourage you to know that pairing positive associations with negative experiences can retrain our brains. Just because things in our life may not have gone well, we can still finish strong. We can't be afraid to try something new. You know, I'm sure that all of us can recall many times when we handled something well, but on the front end, it didn't look so good. We have people from EMS with us today. One of the things that we have to be thankful for is that this National EMS Week is coming upon us. And EMS is one of those frontline agencies that when we go to that call, it doesn't look so good for us sometimes on the front end. but nothing can beat us being able to work with a patient or other patients and get them through the situation that they're going through. Because not only do we help that patient, we grow. Think back in your life. Has anything happened to you in your life where you thought it was a bad thing? It may have been that call, it may have been that phone call, it may have been that experience that you had with someone. And now when you look back on it, you're stronger, and you may even laugh about it, where before, when you were getting ready to go through that problem, you were cringing. It helped you to get through the problem, and it helps you today teach others. Just asking yourself this question: is there any possible way in which this could actually turn out to be good? It presents a realm of possibilities. So let's look at that question one more time. Is it actually possible that, is there any way in which this could turn out to be good? If we take this exercise to the next step, what can I do to make that happen? Begin using this questioning exercise anytime that you're getting ready to face adversity and you need to reach down deep for that resilience that you have. There are some big takeaways from this slide. Having resilience can show itself in many different ways. There's no one right way to be resilient. And these examples are kind of set the stage for us. One of those is respect, respecting yourself even when others don't. Taking a chill pill, listening to some music, being good to yourself, not being afraid to talk to people, not being afraid to have that go-to person to help you through a situation. Being that one person. You may say, well, I'm just one person. What can I possibly do? But if you look through history, there are so many people that stepped up, and they were that one person that made a difference. And the other thing is being kind to ourselves, rewarding ourselves, having that piece of chocolate, even though it may not be a good thing for us at the time, having that ice cream when that ice cream may add a couple calories to us. It's just really big for us to go through this in life. So these are some other key points that we want to talk about. Having a positive mindset and being resilient can help get you out of bed in the morning and put your feet on the ground. There's a lot of things that might keep us from actually putting our feet on the ground and walking out the door. But by having that go-to resilience, it can lessen the chance of us being absent from work or being absent from school. The other thing about resilience is it can help us make better grades on tests that we're taking. It can help us learn. And one of the things that's so important to all of us is three words: lifelong learning is so, so important. One of the things that we want you to do is reduce the risky behaviors such as substance abuse, gambling, and unprotected sex. Another thing we want you to do is to be more involved in your community or family activities. We're going to talk about that in a little bit. That just because we have to be distant doesn't mean we can't adapt and overcome. Maybe meet some people at a park. We can still maintain distance, but we can still be together. Do you know the other thing about learning to be resilient is that if we're going through an illness or an injury, our mindset, in addition to medicine and physical therapy, our mindset can help us through what we're facing at the time. Resilient people experience many different positive health outcomes. You know that being resilient can help us with our emotions. Being resilient and having a positive mindset can help us in those dark times where we're a little bit more depressed than usual. You know, we're going to have high times in our life and we're going to have low times in our life. But by bouncing back and keep moving forward, that symbol of that football field, that all we're doing is just moving the ball down the field one yard at a time. We're going to get to the end zone. It's so important for us to use all this when we're trying to problem solve. having a positive orientation is really big. As we get older, we get a little wiser, but also as we get older, some things become more difficult than others. The big thing is we have to remember how we were resilient before, and that's going to help us keep moving forward. We're going to talk about post-traumatic stress today a little bit more. We've talked about post-traumatic stress in our previous forums, and there's a lot of people out there that deal with it. And being resilient and having a good attitude can help us when post-traumatic stress gets us down. Did you know that your attitude, your resilience can help your immunity system? And the other thing is, having a positive attitude and being resilient can help you through situations such as cancer, diabetes, heart disease, arthritis, and many things that can help you beat the odds. That's one of the big things that we're seeing right now, is we're seeing a lot of people beat the odds. You're seeing people on the news where the statistics say no, but their mindset and their resilience said yes. And that's so important. There's a lot of people that are having they're feeling overwhelmed right now because of the pandemic. And we have to know that we're going to get through this. And one of the people that I want to introduce to you is Kay Knopf. And she's somebody that is really pushed through adversity, and now she helps others with adversity. Kay is a practitioner. She's worked with the Public Health Service, helping people. She even works with first responders right now and helps them in North Carolina to get through a lot of things that they're going through in life. Kay, it's really awesome to have you. We're so thankful for you being here today. You may be muted. Eva, do we have some folks that have had some items that they want to talk about?
Yes, we had a couple individuals. I posed the question in the chat, and the question was, who do you have to help you maintain balance when you're going through a tough time? People have said that a prayer partner, a pastor, mom, husband, family members, BFFs. They've even had an opportunity to go to their own community. Another question was, have you tried Zoom, FaceTime to connect with your family and friends? And most of them had. And there's also another app called Duo that someone has tried. And I think Kay has her access to.
Yeah, Kay, research has shown us that resilience is ordinary. And, but a lot of people don't feel very resilient right now. How do I know when I'm being resilient? What does it look like? What's an example of being resilient?
Well, resilience is basically a person's ability to manage adversity or challenges that happen in their life. We as human beings are born with, there are different levels of resilience, and we as human beings are kind of born with some resilience. And you can see that through young children that are learning how to walk. You'll see them get up and stand up and take a few steps and fall down, and then get up again and try again, and repeatedly over and over they'll get up and continue to try to walk, and eventually they walk, they learn to walk. Well, it's the same thing with adults. You know, we can meet adversity, and sometimes we might fall down or we may not be successful, but our ability to deal with that and learn from those things that have happened and change maybe the way we deal with them and make a plan for how to get around those issues, or, you know, all of these things are a part of becoming resilient. So some people are more resilient than others, because even though we're born with a level of resilience, our resiliency changes over time, and it grows and expands as we meet different challenges in our lives, be them small challenges or pretty big challenges.
You know, I really didn't, as I was growing up and even in adulthood, I really wasn't focused on what resilience was. But one of the greatest things I would see is, you know, unfortunately, we don't have sports right now, but that football player that gets up off the ground and they've got this big piece of grass on their helmet and they just shake it off and get back in the huddle and go for the next play. It's just really big. What are steps that I could take, or others that are with us today, what are things that they could do to build and maintain resilience and kind of foster the resilience I already have?
Well, there are lots of things. The most important thing is to be self-aware. Be aware of your own emotions and aware of the situation that's occurring around you, and be able to know how you respond to things and how you react to things, and have a plan for dealing with those things and learning how to cope with those things, and keeping an open mind. So another thing that's very important with resilience and building resilience is making sure, in that same token, that you're taking care of yourself. You make yourself a priority. Pay attention to your needs and your feelings. Making connections with other people is very important for developing and maintaining resilience. This means not necessarily, you know, social media like Facebook or, you know, some other platforms that are out there, but more in line with real-time connections with people. You know, in the past, we've been able to see people at the workplace, or be with people in our churches, or, you know, be with people in the community at different events. And right now, that's more of a challenge that we're faced with. So engaging with people safely is extremely important in real time, not just by sending a letter or a text message or something like that. You need to be able to communicate and talk to people. Holding each other accountable as well, you know, scheduling time to talk with someone and then being accountable to one another to make sure that that happens. Relying on one another. There's strength in numbers. So relying on one another is another way of building personal resilience, relying on your peers, your family members.
What can we do to combat nervousness and apprehension during the pandemic as the states begin to process and return to work?
Well, that can look very different for different people. But some of the things, there are resilient skills, and there's skills that you can build, tools that you can have, things like deep breathing. So when a person is very anxious about something, their heart rate increases, their breath is more shallow and more rapid. That's a normal response. It's called fight or flight. Many of you have probably heard of that. A technique of simply taking deep breaths, some slow deep breaths, maybe 10 or 12 deep breaths over a period of a minute or 2 minutes, will allow a person to calm themselves. They calm their heart rate. It slows down their heart rate. It slows down their respirations, and it allows them to kind of focus a little more on being in the present moment. And while some people don't really buy into that, it really is both helping them be aware of their situation and kind of calm things down in their mind, but also calming their physical symptoms that are occurring from the anxiety. So that's one thing. Meditation is another thing that helps individuals who are very anxious about things. And meditation, there are lots of apps like Calm or Headspace, things like that you can do. But there are things, you know, like 3-minute body scans that you can do when you're sitting in your office at work, where you're just focusing on yourself and on your body, and getting your mind off of everything that's happening around you and just focusing on something that is within yourself. So that's a way to help alleviate anxiety. And then being aware that there's things that you can control and things that you can't control. That's very helpful for people that have anxiety symptoms, or they're very nervous about going back out in public. Make a plan for yourself. You know, have a plan for what you're going to do in order to engage with individuals socially or safely. make sure that you are doing what's necessary to control your surroundings. Sometimes it's really hard to do, but some people are more comfortable wearing a mask out in public, and that's okay. Do what makes you feel comfortable. So I think those are some really basic things, but.
Thank you.
That's really awesome.
What advice do you have for extroverts going through this period of time in our lives, with people going back to work, unemployment, and other stressors in life? What advice do you have for extroverts and introverts?
Well, for both of these groups of people, it's very challenging. The extroverts, we'll start with them first. You know, extroverts are people who need to be connected to other people. They have that desire to be with other people all the time, that connectedness. You know, I'm an extrovert, and I'm a nurse, and I'm a person who has to, you know, hold your hand through getting a shot or hug you in public. You know, that's just the person that I am. And it's very hard for me to recognize that I have to engage with people in a different way now. And you know, that may look simply like learning how to connect in an environment where I don't get to shake somebody's hand when I walk in the door. You know, of course, there are like the elbow bumps and fist bumps and things like that are going on in a lot of places. But so learning those kinds of things, learning how to keep yourself in a safe capacity when being face to face with others. I think one thing that I've seen a lot is people going outside and having themselves, you know, a certain amount of distance apart, but able to connect and be in an environment that is safe, but yet able to see each other and talk that way. Social media platforms or social platforms like Zoom, I think we mentioned Duo earlier, FaceTime. Real-time activities is very important for people to utilize. And again, holding yourself accountable to somebody else. Make that time to meet with your family every day. You know, have that morning call with your mom, or have that morning call with your best friend, or their afternoon tea with your brother-in-law, or whatever. Making that time. My children are very important in this as well. Children tend to be a little more extroverted than others at times. And one of the things that I've done with my daughter, for instance, is I set up a Zoom session for her and her friend, and they meet on a regular basis every week, a couple times a week. And she just takes her little iPad around and they play horse. She's a horse girl, so she's playing with her horses, and while her friend is playing with her dolls, but they're connecting in real time. It's like they're with one another, but they're not. So that's one thing that extroverts can do. Introverts tend to kind of like being at home a little bit more, but it's really important for them to be engaged. And it's the opposite, is that they have to kind of force themselves to be more engaged. It's really important to maintain that human touch and that human communication. So again, having that partner to talk to or to video with or FaceTime with every day, making that connection and holding each other accountable for that is really important. So hopefully that's some helpful tips.
It is. It's huge, and you know, having some people don't like to be held accountable. They don't like, you know, none of us like to. Well, what have you been doing, or what? But to have that person to ask you the big question, hey, how's it going? You know, they've opened the door, and we shouldn't be afraid to let them know what we're going through. One question I want to close with is, who are the people in your life that have helped you maintain your resilience?
Well, for me, it's been my family. And as a former military spouse, you know, this is virtual meetings and things like that is something that's almost the norm for us. We have friends all around the country that we don't see on a regular basis, but we're still able to connect with them. One of my best friends is in Texas, and I talk to her almost daily. But finding those connections, with those people. So be it friends, be it family members, maybe family members that live with you or family members that are not in your household, connecting with your peers, people at your workplace. In the first responder world, we have designed in Henderson County, we've designed a dynamic peer support network. And so we are actually having individuals that are on the peer support team check in on a regular basis with their coworkers just to make sure everything's okay. It's not about mental health. It's not about anything more than how are you doing? That's it. And they're accountable to one another for doing that. And so having those people, again, my family, my work friends, community members, there are people in the community that you can connect with on a regular basis for whatever tasks you may be doing in the community, but they can be very helpful as well.
Well, Kate, we are so thankful to have you today, and we hope to have you back. And thank you for all that you're doing, especially in your community, and thank you for all the advice that you've brought forward today. We want to recognize a lot of the sponsors for SC Thrive. We hope that you'll go to our Facebook page and our social media. We're on Twitter and Facebook and other social media. Thomas Monroe is with us. He's the Workforce Solutions Manager from York Technical College in the Division of Workforce and Economic Development. He's going to provide us with an opportunity to learn about their course offerings through open enrollment courses and corporate engagement through trainings that they have. Different training. Mr. Monroe, we're really Mr. Monroe. All right. Well, we may have he may have dropped. There you are. Go ahead.
Well, thank you, George. I appreciate the introduction. I just wanted to take a brief moment just to talk about our division and some of the trainings that we currently offer. So as the Workforce Solutions Manager, we are charged to work with area corporations, also agencies, nonprofits, and organizations that look for their training needs. And so at York Technical College, we provide occupational safety training. We also provide industrial training as well. The great thing about York Tech, you'll see a litany of things that we do offer. We do have an e-catalog that's out there on our website. Would be happy to provide anyone if they want to do that. If they want to skill up utilizing their office technology, definitely can do that. We can also work with Robert White, who is our program manager for our health and safety programs. So always a privilege to work with him. If you have EMT aspirations or other things that you want to work on, CPR training, IV therapy, and the like, and others. And then also we do have customer service training and things of that nature. So I wanted to just do a quick overview of what we can offer. And then also we do online training. So if you wanted to do some training right now while you're in this situation to upgrade your skills, we do have an opportunity to do that as well. And you can go on, and it's 100% online at this particular time. So George, thank you. I'll throw it back to you. Great information that you provided, and appreciate Robert working with you all to make this webinar come to fruition. So thank you again.
Well, thank you, Mr. Monroe. We're very thankful for the technical college system in South Carolina. The ability of us to maintain the workforce in pre-hospital care is really big. And the constant message now that college, it's not for everybody, and we can really do well for ourselves, learning a trade or going to taking advantage of all the programs that technical colleges have to provide. Again, thank you all for being here today. I wish you all the best. And please come back and see us the fourth Thursday of this month. That should be the 28th. Have a great day. Thank you so much.
Thanks, George.
George, I appreciate you, brother. Stay safe, and I'll see you soon.
All right.